So on my last episode, I talked about my biopsy. Now I'm going to cover some things that I had to do before my first radiation treatment. And these things include a PET scan, an MRI, hormone therapy, and a DNA test. So let's talk about it.
Urban Christian Veterans provides a safe place for Christian veterans of color to discuss the challenges you face in your daily lives. Being a person of color has its challenges. Being a Christian has its challenges. Being a veteran has its challenges. All of those factors being combined makes for a unique and sometimes difficult life experience that is seldom talked about in public forums. Thank you for tuning in to the Urban Christian Veterans Podcast. Here's your host, D. Allen Rose.
Thank you, Aaron, for that wonderful introduction. This is D. Allen Rose, and you are listening to the Urban Christian Veterans Podcast. Okay, so a PET scan, that is P-E-T, PET scan. The purpose is to see if the cancer has spread beyond the prostate and determine the stage. And it just so happens that mine is stage 2. And as far as the stages go, the way it was explained to me is stage 1 is where the cancer is like localized to a small area and it hasn't spread to lymph nodes or any other tissues. So that's stage 1. 2, the cancer has grown, but it still hasn't spread. And that's where I am. And I kind of knew that, my, stage was 2 because after the PET scan, they began to refer to it as a tumor, which means it had grown into a tumor and it's more than just cancer cells being present. So I had a tumor, but it hadn't spread anywhere yet. So that's where I am, stage 2. 3 is where it has grown even larger and possibly spread to lymph nodes or other tissues. And then stage 4 is where the cancer has spread to other organs or areas of your body. So for me, I'm at stage 2. Now the PET, P-E-T, stands for positron emission tomography. I have no clue what all that means, but I looked it up. I needed to know what the PET stood for. And in this procedure, they use this radioactive drug. They refer to it as a tracer. And it's basically what they call glucose that has been made radioactive. And it gives off this energy in your body, which can be seen by the scanner. And when you get this stuff injected, the cancer cells show up as like bright spots on a scan. And the reason why is because they have this higher metabolic rate than typical cells. So for example, cancer cells grow quickly and that needs a lot of energy. And when these cancer cells are using up this energy, the high metabolism, it burns a lot of sugar. And the increased uptake in sugar makes them show up as bright hot spots on the scan. So the glucose or the sugar that they inject into your body causes the cells, the cancer cells, to start burning that sugar. And again, they show up as bright spots on the scan. And this is also why, by the way, they say that sugar is not good for cancer patients. So if you have cancer and you're eating sugar, you're basically feeding the cancer because that's what they use to grow. Now, as far as the machine, it looks like a big old giant donut, right? I mean, it's compared to an MRI that looks like a tube. This thing looks like a big giant donut, big round. And you lay on this table and the table slides you into the middle or the center of this donut. Now the prep, this is wild. Okay. So the prep for the PET scan, they tell me I had to do an enema the night before and then wake up and do another one 2 hours before the procedure. They want you to, when you get there, you're going to empty your bladder. They're going to inject the tracer into your arm in the form of an IV, but it's not an IV that has the little bag that drips. It's an IV they put in your forearm, but it's administered from a little metal cylinder. So you get that injected. And what's wild about that is the gentleman tells me, okay, you're going to get this injection. You may smell it. You may even taste it. And for most people, it tastes like sugary. So I get this stuff injected. And sure enough, I tasted it, like a sweet taste, but I guess the best way to describe it, it's sweet, and it had like a medicine-y aroma and taste. So sweet medicine, if that makes sense. So that's in me. And then they put you in this quiet room for an hour. And they say, okay, go into this room. The room is kind of, the lights are down low. They want you to relax. And they put this blanket over me, warm blanket. I mean, literally a heated blanket. Like they pulled it out of this heating apparatus, put the blanket over me, sat me in the room. Need you to stay in here for an hour. We're going to come back and get you. And while you're in there, you can look at your phone. You can just chill, hang out, whatever. But we need you to be completely relaxed. I don't know the science behind it, why, whatever, but we need you to be relaxed before you go into this procedure. So I spend an hour in the quiet room. They come back and get me. They say, okay, we need you to go and empty your bladder. So they want your bladder to be empty before the procedure. So go do that, go to the bathroom. And then the scan. The cool thing was I didn't have to get undressed, right? You keep your clothes on. You just have to ensure, like, if you don't have any clothes that have metal fasteners or anything, sweatpants with no metal in it or whatever, t-shirt, everything was good. The scan itself took about 20 minutes. So in all, I was there, took about 10, 15 minutes to go back, an hour in the quiet room, another 20 minutes of the scan itself, and you come out of there, and that was it. So a total of close to 2 hours at this place for this PET scan. So that's that. Then after that, a few days later, I had to do an MRI. With this, you had to do some fasting, no eating for, the day or the night before or whatever, after midnight or whatever it was. I had to do an enema again, and I could only drink water. And not only could I only drink water, but they were like no carbonated liquids. So straight water. And with MRIs, I mean, I've had issues with MRIs in the past, right? Because they put you in, you lay on the table, they put you in this tube looking thing. But this was cool because of where they were scanning. I was able to go in feet first. So my head wasn't completely covered in this thing. So it was still loud, but it was in there. I don't know how long that took. Didn't take long, 15, 20 minutes as well. So that's the end of that. Now, I also had to do a DNA test. I didn't have to. So what ended up happening was I received a call from the VA lab asking if I wanted to have a DNA test done on my biopsy sample. Now, the purpose was to see if the cancer was possibly hereditary. And if so, I would be able to advise my brother and my sons to begin getting tested regularly. So I agreed. I was like, yeah, that's cool. Let's go ahead and do it. And the person from the lab said she would meet me at the urology department at my next appointment. So we didn't have to set up a special appointment for this. She said, just call me when you get here and I'll meet you in urology department. So what I did was I timed all my appointments at the VA for the same day. I had to do the hormone therapy. I had to go meet with the urologist to just basically a follow-up to let them know that I had decided to do radiation. And while I was there, I was going to have this DNA test done. So first things first, I go to my appointments at the VA. First one is going to be this hormone therapy appointment. And the purpose of this hormone therapy is to stop testosterone from being produced in your body. And I'm told that this helps the cancer, or it helps stop the cancer from growing when you stop testosterone from being produced. And so this was recommended by or ordered by the radiation oncologist. I'm at the VA, so I was like, okay, we're going to go ahead and do this hormone therapy. And they gave me 2 choices of medicine. Sorry, let me back up. The VA didn't give me 2 choices of medicine. Because I'm getting my radiation therapy outside of the VA, the radiation oncologist that I'm seeing in the community recommended a particular medication. She recommended this medication called Orgovyx and basically said, we recommend this medication because when you stop taking it, it will leave your body faster than the other stuff. And so, they're like, yeah, we recommend this because it'll leave your body faster. Now, the VA recommended this other medication called Eligard. It's a shot. And so the difference is the Orgovyx is a pill that you have to take religiously every day for, in both, well, the Orgovyx would have been 18 months. The Eligard, the VA says 2 years. The Eligard stays in your system longer after you stop taking it. And the cool thing about the Eligard is it's a shot. You get it and it lasts for 6 months. They have a 3-month dose, but I went with the 6-month. So I had this option or these choices between these two medications. But then that ended up in a back and forth with the VA, right? Because my outside oncologist was like, we want you to use this Orgovix. VA is like, we want you to do this Eligard. So I tell the radiation oncologist at the VA that I want to use Orgovix. It was recommended by the oncologist that's actually going to be doing the radiation therapy on me. She recommended this. And since she's doing everything, let me go ahead and get that. The radiation oncologist at the VA says the VA doesn't use it. And if I wanted it, I would be on my own and have to pay for it myself. So I was like, wow, okay. Now, mind you, the oncologist outside of the VA said specifically, we have other VA patients. Right, we treat other veterans from the VA. This is what we give them. So I got this one doctor saying the VA does have it, but the doctor at the VA saying, no, we don't do that. So I did some research, and here's what I found. So the Orgovix compared to the Eligard, the retail value of the Orgovix, from what I saw, was like between $87 per pill all the way up to well over $100, like $120 per pill. And you have to take that every day. Well, that's the retail value. The other stuff and there's more than just one other medication. There are other medications, but every other one of the medications retail valued at less than $1 per pill. And that it just so happens that the VA pushes for these cheaper alternatives. Again, the difference between the two being that the more expensive one will get out of your body quicker. It won't linger as long as the cheaper one. But in addition to that, there was more of a risk of cardiovascular issues with the cheaper stuff. So I did the research to know what the medications were, the differences were, and then I even researched further and found that the VA does in fact have the generic brand of this Orgovix, the more expensive one, and it's called Relugolix. So I sent the message back to the oncologist at the VA. And I said, you're correct. You don't use Orgovix, but I did find that you do use the generic brand, the Relugolix. So since you do have it, could you go ahead and just give me that instead? He quickly got back with me within 30 minutes, hit me back and said, well, I can't give it to you, but maybe the medical oncologist can. I'm going to put in a consultation for you, a referral for you to go talk to them. Well, it just so happens that I already had an appointment with them anyway that was scheduled several weeks prior. I just never met with them. And the way this whole process worked was I was supposed to meet with all the oncologists first, see what all of them had to offer in terms of treatments, and then make a decision from there. Well, it just so happened the way the scheduling worked, and I just never got around to meeting with the medical oncologist prior to all these other things happening. And so now this was going to be my first time meeting with them. And it just so happened that it was the same week. So I called, rearranged some things, said, let's see if I can talk with this medical oncologist that week. Let's talk about it, and so on and so forth. So anyway, I go in and meet with the medical oncologist, and it was wild. That was wild. Here's why it was wild. So my wife came with me. We're in the medical oncologist's office. We're in the waiting room, and all throughout the VA, there's these signs posted. I guess there's a policy where they don't want to have you sitting in the lobby without having been seen for more than 15 minutes past your appointment time. So we get there, we check in. My wife and I were sitting there. Sure enough, within 15 minutes, they call me back to get my vitals, right? Your weight, blood pressure, temperature, all that. Okay, that's done. I go back out into the waiting room and I'm going to meet with the doctor next. Well, we're sitting there and we're sitting there and we're sitting there and we're sitting there. And I find that I'm still sitting there coming up on an hour after my appointment time. I think my appointment was at 11 a.m. It's coming up on 12. So I was like, you know what? I'm going to give them 5 more minutes and I'm just going to go and tell them reschedule because I'm not sitting here anymore. Just not going to do it. So anyway, 5 minutes passed. I go up to the front counter. And when I get to the front counter, they treat me as if I just got there again. Hey, you here to check in? I'm like, nah, I did that almost an hour ago. I'm here to reschedule. I need y'all to reschedule this because I'm not waiting anymore. I've been here almost an hour. Time for me to go. And so the Person behind the desk is like, okay, well, let me see what's going on. I don't know, some kind of way they did something, and all of a sudden a supervisor showed up, and she was like, hold on, Mr. Rose, let me go back and let me see what's going on with your doctor. And I was like, no, you ain't got to do that. I've been here almost an hour. She's like, please bear with me. Let me just at least go back and see what's going on. Okay. So I'm sitting there, maybe 2 minutes. She comes back. Okay, no, he's back there. He's looking at your chart now, and there's nobody in the room with him. So I promise you, he's just looking over your chart, and then he's going to come back out. He's going to come out and get you. Give him maybe 1 or 2 minutes. I'm like, all right. Took me an hour to get up here. Been sitting here an hour, 2 more minutes. Cool. And go sit back down with my wife, tell her what's going on. Lo and behold, he comes out and calls me back, and she goes back with me. Well, turns out he's not the doctor. He's a resident. The doctor that I'm supposed to be meeting with is out of the office that day. So I'm here meeting with the resident. And for them, you got to remember, this is like an intake. This is, for them, they're thinking that I haven't gotten as far as I've gotten. And this is the initial meeting, as if, okay, we see you have cancer. Let's talk about your options. And so he began with, did you go to the lab? I don't see your lab results here, because that's typically how it is. When you go to the medical oncologist, you first go to the lab and then you go to them all in the same day. So I had to explain to the young fella, I'm not here for that. In fact, I'm only here for one reason. I'm beyond all of this. I'm here regarding a medication. I was told that, I had to explain to him, look, I'm already community care. We're way down the path of radiation treatment. I'm not here for all that. I just want to know if you can give me this medication that I'm looking for. Again, young fella, he hears me out. I told him community care recommended Orgovix or Relugalix, which is the generic brand. You guys, VA meaning, have recommended Eligard. I prefer the Orgovix. Can you hook it up for me? Young fella says, well, can you mind telling me why? So now I'm getting a little irritated, right? A little bit irritated, because I would have thought that the radiation oncologist at the VA who did the referral would have typed all that in for me to explain to you why, or not have to explain to you why. Anyway, so I just gave him bullet points. My understanding is that this stuff will come out of your system a lot faster when we're done taking it. That's why. And on top of that, from my own research, I found that the risk for cardiovascular issues is higher with the stuff you're recommended. So can we just go ahead and do that? This young fella goes on to want to give me this long explanation and explain the different medications and the differences between them. And he's pushing me towards the Eligard. And so he gave me this long, drawn out explanation of the two medications and so on and so forth. And then he says, so can we go ahead and move forward with your Eligard? I'll put that in for you. So I'm like, nah, partner, that's not how this goes. I hear you and I listen to you. That's not what I want, though. Can we go ahead and hook this up? He says, okay, hold on. Let me, if you don't mind, I'm just going to type in these notes, finish up, we'll go ahead and move on that. But let me first, the doctor that you're supposed to be meeting with is not here. Let me first just consult with the doctor on duty, and then we'll get you going. In other words, put in the request for the pharmacist. So he leaves the room, and me and my wife are there, and, just kind of chit-chatting. He comes back in about, 2 minutes or so. And he says, okay, the doctor's on the way. Let's just give her a second. She wants to meet with you first. So, what it felt like? It felt like going to a car dealership and you're in there negotiating and you're like, nah, I want this car for this price. And they trying to spin it and all this other stuff. And you just can't come to the agreement on it. But no, this is what I want. I want this car for this price. And then they'd be like, well, hold on. Let me go get my supervisor. That's what it felt like. So in walks the doctor. Actually, runs the doctor, female doctor, nice lady. But she came in out of breath. I mean, really out of breath. And she talked really fast. She talked fast and had a heavy accent. And she came in out of breath, introduced herself. She sat down. She said, pardon me for being out of breath. Just got back from rushing a patient to the emergency room. I'm like, word? Okay, so to put it in context, I am here because I have cancer. And I'm here to talk to doctors about some stuff. And you rush into the emergency room. I don't know what that situation is about. Not something I really wanted to hear at that time. Rush into the emergency room. Anyway, so I was like, okay, good. It's cool. All right, we were just on our way out. And she's out of breath and, she's trying to catch her breath. And says, okay, so Dr. So-and-so, won't say his name, cool little fella, says that you're wanting this stuff. And may I ask why? I was like, look, again, with that, and then so the resident, he speaks up. So I don't have to explain it all again. But when he said it, he says, and also Mr. Rose here he's concerned about side effects. Like, no. I'm not concerned about any side effects. I'm concerned about how long it's going to be in my system at the end. Oh, yes, you're right. That's what you said. So now I'm irritated. Now I'm really irritated. But the doctor, she was nice, right? She was nice. And then she wanted to give me her spiel and an explanation of the two medications and so on and so forth. And I was like, I hear you. But can we go ahead and, and she was like, well, you also understand that if you get this other medication, you're going to have to take the pill religiously every day. You can't miss a day. Yeah, I get it. Hook it up. Can we hook it up? Then I explained to him that currently the VA has me on 9 medications. So I take 9 a day. Adding another one to the mix is not going to be a big deal. Can we just go ahead and hook this up? So finally, she then says, well, it's not up to us. What we can do is put in the request, but the pharmacy is the one who has to make the determination because the VA doesn't issue this medication unless you meet a special condition. And it's up to the pharmacy to see if you meet that special condition. What we can do today is put in an appeal for you, but it's not a general practice that we issue this medication. So at this stage, I'm like, all right, whatever. Do the appeal, whatever paperwork you feel like you need to do. Let's hook that up. So they put in the appeal. I was like, okay, well, when am I going to hear something? They said within the next 2 days, you should hear something. I said, how am I going to hear about it? Oh, we'll call you directly. Okay, fine. So that was the end of that. Well, no, that was not the end of that. Right before we leave. Now, mind you, my wife, she's there. She's over there taking notes. Because that's what she does. We go to these things and she has her notebook out and she's always taking these notes. And I really appreciate that. It's cool. The resident, he's over in the corner. He's taking notes. We have come to the agreement that you are about to do this appeal for me. So I guess, I don't know if he's taking notes or he's filling out the appeal paperwork. I don't know what he's doing. He's typing, clicking away at the keyboard. So the doctor is talking to me and she said a bunch of things and I can't remember everything she was saying. This is why I can't remember. She said these words and it threw me all the way off. I can't remember nothing she said prior to or after. She said, don't worry, because both medications are equally effective at medical castration. All right, I'm going to pause right there. Medical castration. So my antenna went up. I'm looking around the room like, word? Like, we just going to act like she didn't just say that? I'm looking over at my wife. She's taking notes. Didn't even look up. Looking over at resident dude, he's still typing away. And when she said medical castration and she kept on talking, like she breezed right on past it. And I'm like, medical, yeah, like what? So that was the first time I had heard that term in this whole process. Medical castration. So I don't remember. I honestly don't remember what she said after that. I was stuck on that. Both medications are equally effective at medical castration. Breezed on past it. And then it was time to go. So I was just like, man, every time I come up in here, there's always some drama with this, at the VA. Man. But anyway, so they filed the appeal. Long story short, pharmacy denied the request because it didn't meet conditions, special conditions. And the special conditions, they put it in writing for me. The special condition that I did not meet is that I had to have had an adverse reaction to other medications in order for them to give me this stuff. So they denied it. When it was all said and done, I was like, you know what, whatever. I just gonna get the shot. So that was that. A few days later, it's time for the shot. And so I go to get the shot. But prior to, the night before I go to get the shot, sitting in the living room watching TV with my wife. My dog jumps up in my lap and I say to him, well, tomorrow, me and you gonna be in the same boat, buddy. My wife said, what? I said, tomorrow, he and I are going to be in the same boat. And she's like, well, what are you talking about? I said, you didn't hear what that doctor said? So what? I said, she said both medications are equally effective at medical castration. And she's like, what? I was like, hold up, you didn't take them notes? You was over there writing. I figured you wrote that down. She said, I didn't hear that. And again, that's why I mentioned before that it's always good to have two sets of ears, because depending on, the situation, one will catch something that the other won't. And yeah, you say castration around me, yeah, I'm gonna catch that one. She didn't catch that one. So we laughed about it or whatever. But it's like, all right, medical castration. Yeah. And also, the doctor did have a heavy accent. She was talking fast, so I get it. I understand why my wife might have missed it. She was writing, and I caught every word. So anyway, this adventure that day of the whole shot thing, I go to the VA. This time I went by myself because it was nothing more than just getting a shot. And I wasn't going to talk to anybody about anything. So I'm going up there by myself. Now, the wild thing is I had to go to the pharmacy and pick it up myself. So I had to go to the pharmacy. I pick up the medication. Luckily, the medication was ready when I got there. So I didn't have to register, wait, and all that other stuff. Went straight to the front of the line, picked it up. One thing I did notice though, so I picked the stuff up. Oh, it had to be refrigerated. So they had to go to the refrigerator to pick it up, bring me the box, and the box was longer than I expected. First of all, I didn't expect a box, pharmacy, I'm thinking pills, whatever, but it was longer than I expected. So, and I knew it was a shot, right? Because we talked about that, pills versus shot, but still the box was long. It was like 12 inches or more. Yeah, I didn't think about it. I was like, okay, well, that's unexpected, but whatever. So I take the box myself from the pharmacy down to the radiation oncologist office where I'm going to meet the nurse who is going to give me the shot. That in and of itself was wild because I was thinking, man, y'all are in the same building. I'm driving an hour. Seemed like you could have just went up there and got it and just had it or whatever. But anyway, so I go down there. The nurse says, okay, which side do you want it on? I say, right side. She says, okay, lift your shirt up. So I lift my arm. I lift my shirt up above my shoulder. She said, oh, no. She said, you have to lift from the bottom because the shot is done in the abdomen. I hate surprises. Oh, I hate surprises. I was not expecting that. And we're not going to just give you the shot right now. We first have to put an ice pack on you to numb the area. So that is their way of doing a local anesthesia. It's ice pack. So I lift my shirt up. She puts an ice pack on the right side of my stomach. Says I'll be back in a couple of minutes. So this ice pack situation, I never had that done before, but that's a new experience. So put the ice pack on you, and it's real cold, right? It's real cold. And if you've ever had, been really, really cold, like to where your fingers are frozen, if you pay attention, what happens is your body goes through different stages. At first, you feel cold. Then your fingers will hurt, and then they get numb, like you can't feel anything. And that's what I went through. This ice pack is sitting there. It's super cold. And it started to sting at first, and then just was numb. I couldn't even feel it anymore. So she comes back in, says, okay, we're ready. She breaks out the medication out of that long box. And sure enough, on the inside, there's a long tube. I was like, oh, man. So just before she puts the little syringe on and all this other stuff, she says, okay, it's very important that when I inject this, after I inject it, you do not rub it. Do not rub the area. No matter how much you want to, you're going to want to rub it. Do not rub it. It's like, okay, why is that? Just curious, because I got to know these things. She said, because the medication is going to form, once it goes into your body, it's going to form a gel. And it's important that you do not rub it because we want it to form that gel. And over time, the gel is going to break down on its own. And that's what's going to make it last for 6 months. It's like, oh, okay, cool. So she goes to inject me in my stomach. I got a wild imagination. She's sitting there. She's injecting me with this long needle. Well, no, the needle wasn't long. Whatever you call that thing with the medication in, tube with the medication in, that was long. And I got this wild imagination, man. I just swear, all I could just imagine was somebody is got this big giant air pump, bicycle pump or something, as if she had to reach up to the ceiling and pull down on the plunger and was just pushing that thing in slowly. I was like, oh man, because it was taking forever for her to finish injecting. On top of that, it burned. And this stung or burned more than most, like even more than the antibiotic I received in my behind before the biopsy. It stung even more than that. And it was a different sting, but I call it sting. This is more of a burning sensation. And it was so much of it. And I guess the closest thing that I can recall feeling like this was, I don't know, within the last year. I got the shingles vaccine. And I remember getting that shingles vaccine saying, man, that thing burned. Like it burned like that. So she's injecting this thing in me with this big giant bicycle pump. And she's finished and she goes to, when they're done giving you a shot, how they put the little gauze on and the tape and all of that, the area was just burning. And so when she was doing all of that, that was even burning. Oh man, that's not pleasant at all. So that's done. Got the shot. 6-month joint. And they've already scheduled me for the next 6 months. 6 months from there, I got to go back, get the other shot on the left side. And this stuff has to happen for 2 years. So I'm going to be medically castrated for 2 years. Now, that's another one of those things that I think men who have this situation or in this situation, why they don't talk about it. I don't think the average dude wants to talk about this type of stuff or admit that they're going through this. So that's what it is. And so if you ever have to deal with this or you know anybody who is dealing with it, this is one of the things that they're dealing with. It's regardless of whatever the medication they're taking, they are medically castrated for a minute. And the hope is that when you come off the medication, things go back to normal. So it is what it is. Okay, time to head to urology. I have to go up to the urology department just to meet with them just long enough to tell them, hey, I'm going on with the radiation, just like a follow-up. But meanwhile, while I'm there, remember the lady from the lab is supposed to come down and draw blood for the DNA thing. So I call her when I get there. I check in at the urology department, sitting in the lobby. Now, here's the thing. When I get up there, the climate changed. And I found out that the AC in that wing of the building was out that day. And the VA hospital is always crowded. So it's crowded and the AC is not working. So people are in there crowded and miserable. And I just walk right in there with them. Go in the waiting room. It's hot. Oh, it's just so hot. I mean, nurses walking around with carts of water, offering water to everybody. I'm sitting there. It's hot. And the lab person, she comes and she meets me in the waiting room in urology. And she says, well, I don't have a room here. Do you mind coming back to the lab with me? I'm thinking, all right, well, got to be better than this, man. So leave out of there. I don't know where the lab is. And she's walking fast and it's hot. So she's walking fast. I'm kind of trying to keep up with her. It's hot. I got this thing burning in my stomach. And where we're walking, it's starting to look familiar. I'm like, hold on. And I realized we were walking back past the pharmacy where I was earlier. And I'm thinking, man, I could have just stopped while I was in there, while the AC was still working. But I had to walk. And it's a good little distance from urology to the lab. So we're walking. It's hot. We get back there. She draws the blood. And now I got to rush back to urology so I wouldn't be late for my appointment. Long walk. It's hot. I get there, and as soon as I'm walking into the waiting room again, they're calling my name. So luckily, I didn't miss my appointment. I get back there, take my vitals and my blood pressure, my temps, and my blood pressure was slightly elevated. And I had to explain to them, yeah, it's elevated because you got me running around this old hot hospital back and forth. Anyway, they took it. It was kind of high, but that was the end of that. So takeaways. I don't know about you, but I hate surprises. I can't stand to be surprised about stuff. And I usually do pretty good at being prepared, but none of the research I did online prior to any of these procedures explained in detail the things that I experienced. So I'm sharing so that others know what to expect. I mean, I'm talking about the doctors don't explain it in this amount of detail. And others who have gone through it don't seem to get into here's exactly what you can expect. Now, I understand everybody's situation is different, but this is what I experienced. So this is a possibility for you in terms of the medications, in terms of if you're going to get the shot in the stomach or whatever, just be prepared for that stuff. The preparation for the PET scan. That was kind of a surprise. I didn't know that was going to go that way. But anyway, these are the things that you want to be prepared for. Also, another takeaway is you have to advocate for yourself. Oncologists are specialists in their field, and they seem to promote what they do over everything else. And they stay in their lanes. They deflect. It seems like they seem to deflect any potential issues to other areas. And here's what I mean. It reminds me of being in the IT field. Like I have over 30-some years experience in IT. And I've worked in just about every aspect of the IT field, everything from hardware to software to servers to networking, and every department, area of expertise that I've ever worked in, the culture is the same. When someone says, hey, there's a problem, it ain't us. My stuff is working. And that's what the oncologists seem to do. Because when I my experience has been so far that whenever I tell one of the oncologists about my symptoms and what I'm experiencing, they say it can't be what they're doing, and they refer me back to my primary care physician. And so I bring it up because they ask, how do you feel today? Are you in any pain? Are you experiencing any symptoms? And I tell them, yeah, this is what I'm feeling. Oh, well, it's not the radiation, or it's not whatever. And it was wild because a few months ago, I was at an appointment with my primary care physician at the VA, and a nurse practitioner at the office said something that made the most sense of all, even beyond any of these specialists. She said, what I may be feeling or what I feel may be related to fibromyalgia. And yes, that is one of the underlying conditions that I have, that I had prior to this whole cancer thing. Right, as I mentioned, I am a 100% disabled vet. And I've already had. So that'll tell you. I have all these other things going on with me prior to, and now I got this cancer on top of it. And she happened to look at my chart and just say, this is what it could be. She said, fibro can be triggered by stress, both mental and physical, on the body. And cancer is causing stress on the body. And fibro is more than just pain. It can include fatigue, nausea, what we call fibro fog, or trouble concentrating. And I'm experiencing all those things, and I have been experiencing them for months. And all the oncologists that I bring it up to, they all say, well, no, it's not me. It's not what we do. And so, just keep that in mind, that the oncologists all seem to stay in their lane, and nobody seems to take a look at the big picture. Yes, you may have cancer, but if you have any underlying conditions, then it could be triggered by your new condition. So you might want to just keep that in mind. Everybody's experience is not going to be the same. And so I'm saying that too, because in my research, what I found is that I'm out here researching, and I've joined all sorts of groups online and getting other people's experience from their, journey with this prostate cancer. And I just noticed that very few have experienced the symptoms that I do. And I only bring it up now because, this is about the prostate cancer thing. It's not about the fibromyalgia. It's not about that. But overall, this, my experience is what I'm feeling: fatigue, nausea. I happen to bring this up to radiation oncologists. Yeah, fatigue. And I'm so tired. I always feel like I need to, after every meal, it's like, I wish I didn't eat it. Trouble concentrating, and it's not the radiation. Radiation doesn't do that. Okay. So I keep hearing what it's not, right? So just need you to just remember that one of the things I've learned is I can't go by somebody else's experience and expect that that's going to be mine, because I've talked to and I've read other people's experiences. Talked to people and they tell me about it. Read what other people have written, and I've just heard and some other guys say, "Oh, it was a breeze. It wasn't that big a deal. I went through it." Like, I'm going through all this, and I'm like, why? Why am I like? Why is my situation not like? Why does my situation always got to be all extra? So that's a takeaway. Just remember, your journey is your journey. Your stuff is your stuff. You may not have the same experiences that everybody else have. So just remember that. And then on top of that, everybody you deal with is a human being. So the experience is not going to be perfect. Nobody's perfect. I don't blame the oncologist. I don't blame the doctors or whatever. They're all human. You just assume that they're all doing the best that they can. Pray and ask God to guide them, and assume that it's done. And if that's the best they can do, that is the best they can do. You just have to step in and advocate for yourself when you are led to do that. So that's the end of this episode. I just completed my first week of radiation therapy, so I'll be providing details about that in my next episode and weekly updates thereafter. So until next time, be safe, take care, and we'll talk again soon.